Can we remove a lipoma via liposuction? We can. Only a select. It's quite not that common to do it with liposuction. It can be done, but it's not that common. So the problem with removing a lipoma with liposuction, it would have to be a pretty big one, because a small one you can often take out through a relatively small incision. So it's kind of like, what's the benefit of doing liposuction? Because if you're going to use an incision about the same size, why don't you just take it out sort of normally, where you can actually see it and you can see the edges of it, and make sure you get it all out. Although I did say earlier that you can sometimes have multi-loculated ones, but you can be a bit more reassured that you're getting out if you can see it and you can see the borders and get it out completely. But if it's a very large one, if it's in an area with bad scars, I remember I did one on the shoulder here, which is potentially an area of bad scars, a really big one. With liposuction is an option. Good thing about liposuction is it's just little stab incisions. Problem with liposuction is can't really send it for histology, or at least it's more difficult. You could potentially send a lipoaspirate for histology, but if you're worried about it, if you think it might not be a lipoma or be something else, you wouldn't really want to be doing liposuction, because you want to be sending that specimen off as a discrete thing, so they can have a proper look at it and be absolutely sure what it is. So you'd have to be completely sure it was nothing worrying, because of the histology side of things. The other thing is you're not going to remove any skin when you're doing liposuction, but that might be fine. But sometimes if it's tensing up the skin a lot, you can remove some skin to tighten the skin a bit. But it usually recoils pretty well once the lipoma is gone. And I guess the other thing is the sort of anesthetic. Liposuction is a bit uncomfortable. It's kind of like a sort of metal rod that we put in to suck the fat out. And so usually it's kind of like either a general anesthetic or local with sedation, whereas excision can often or usually be done under a local anesthetic. It's not 100% because a very big one might need local anesthetic or general anesthetic, but we've done some pretty big ones under local actually. So you can do fairly large lipomas under a local anesthetic, but if it's kind of really, really large, then you might want to consider local sedation, and so that would make it more in line with the liposuction side of things. So I guess, yeah, no histology is the downside, and also a bit more difficult telling whether you got it all out, because it's you can't really see it, whereas when you do it under direct vision, you can be more assured of getting it all out. Although, as I said earlier, there's always a risk you can leave some behind if it's multiloculated, but it's there's usually quite a nice border with them, and you can be quite confident that you've got them all out when you're excising them, but you don't really have that benefit when you're doing lipo.